Hi, my name is Wendy Ellis. I'm a naturopathic doctor and a physician consultant for Meridian Valley Lab. I bring nearly 25 years of clinical experience to my work with Meridian Valley Laboratory. And today I'd like to focus on food sensitivity testing. I think it's really important to stratify the difference between food sensitivity and food allergy. Food allergy is an immediate hypersensitivity response. It usually involves immediate care with epinephrine or Benadryl. And for our purposes today, we are talking about food sensitivity using the IgG subclass or IgG immunoglobulin, specifically the IgG4 subclass. Over the course of time, we've noted a rapid increase in the number of food sensitivities and allergens in our patients. This is likely due to environmental pollution, exposure to microorganisms, as we're getting food from all over the world in our grocery stores, and processed foods. So we're experiencing a lot of chronic inflammatory conditions, and we know chronic inflammation is bad for our bodies. It breaks our bodies down. And so how can we determine which foods our bodies are most sensitive to? We have found that IgG, specifically the IgG4 subclass, has been really helpful in patients determining which foods are inflammatory to their bodies, doing the testing, eliminating those foods that are sensitive, and having an improvement in their symptoms. Some of these chronic conditions could be related to skin issues, eczema, psoriasis, acne. It could be digestive, gas, bloating, irritable bowel disease, irritable bowel syndrome. Could also be joint pain. It could be difficulty losing weight. There are so many reasons and causes that are associated with food intolerance. About 75% of the immunoglobulins circulating in the body are of the IgG subclass. And over time, as our bodies become more allergic, so to speak, or sensitive to the things that we're eating, we have noted an association with an increase in that IgG4 subclass associated with chronic exposure to things that our body is sensitive to. How do we do the test? It's a simple blood test. Traditionally, elimination diet has been the gold standard. However, it's really difficult to do a full elimination diet. And so I find that doing the IgG4 immunoglobulin test has been really helpful in narrowing down the list of possible sensitivities and then working with my patients to introduce the things on that list one at a time, 3 to 7 days apart, and look for that symptom that's bothersome. Of course, some of these things could take, weeks to months to improve. However, once you've eliminated and reintroduced a food, you generally have a more acute symptom as compared to that chronic skin condition, for example. Your skin is not going to improve overnight. So that's really important to know. So when we're looking at food intolerance testing, it's a really important way to look at the whole body's inflammatory process. And we're eating foods many times throughout the day. And so this really helps us to narrow down the things that our body's sensitive to, eliminate that, and thus reduce chronic whole body inflammation, improving overall health in the long run. We do offer physician consultants when patients do food intolerance testing. We do a lot of consultants with other physicians to help you determine how to approach patient care. So if you have any further questions, please feel free to make an appointment with us, and we look forward to supporting you. Take care and have a great new year.